So, Dr. Hassan, thank you for joining this evening, your time. I appreciate this very much. And it's been great to just get acquainted a little bit before we start this interview. So, as I mentioned to you, the BYU Management Society has their Young Professionals Career Engagement Program. And we thank you for participating in this first phase of it, which is giving young people introductions to careers. And so we're most appreciative of your time. You're a wonderfully accomplished individual. And would you mind just introducing yourself to our audience? It says, a little bit about, where you're from and what your career is, what you do, and a little bit about where it's taken you and the opportunities that you've had because of your diligence in developing your career.
Thank you very much for inviting me. It's very exciting when I got the invitation. My name is Dr. Kunle Hassan. That's what most people call me. My full name is Kunle Hassan. I'm from the western part of Nigeria, the Yorubas, and I'm from Ijebu, part of the western part of Nigeria. At the moment, I'm 71 years old, and it's been quite an exciting journey. I mean, I was born into a Muslim home, but my father is a very liberal person because most of his friends are reverends, and so he allows us to choose our religion. He doesn't really bother. So I'm of 14 children, and I'm the fifth born, and 9 of us are Christians and 5 of us are Muslims. So we have a mixed grill whereby even I invite some of my Muslim brothers to our state conference and meetings that they come. And we too, when it's their festival, we also go there. So we have that very great understanding within our family. I was born in Elisha, which is part of Western Nigeria. I went to primary school, and then I entered the secondary school in 1968, which is Elisha Grammar School. It's one of the special discipline, highly disciplined school. And I was very young then at the age of 10, I didn't know much. So I virtually played with my first year, not doing much. And I failed the exams or promotion exam, and I have to repeat the class. My father, being a very strong disciplinarian, usually look at our results at the end of before going back to school. So I opened my results, and my brothers and sisters were there. And whatever is going to be your pocket money or anything you want to do depends on your grade. So he gave them the money and all things necessary for their books. And when it came to my turn, he brought out 3 pairs of shorts and 3 pairs of shirts and said, I've signed an agreement with a mechanic next door. I think you will be a mechanic. These are local mechanics that repair cars. He said, I don't think you have the flair for education. By the time you do all this, you learn more. And when your brothers and sisters come back from overseas or whatever they study, you have a lot of cars to maintain. It was a straight challenge. And I look at my father, I couldn't believe it. And I went back to him. Then I went to my mom to please help me to have change. And my mom told me, well, maybe it'd be better to be a printer, a local printer than a mechanic. So maybe I asked him to allow you to go and be a printer. So each is devastating, but I made up my mind. I was going back to school. So I went back to school, and my father refused to pay my man school fees. He say, well, if you repeat a class, you pay for it. I pick up when you pass. And that's, so I got an odd job in a bookshop. And from that bookshop, I make a stipend, and I was trying to pay some of my fees, which is not enough. But I learned a lot through that. Good enough, my mother was able to pay the balance. And then my father, when my result came, I came first. My father said, you have 80%. And you came first, divided by 2, that's 40%. So you failed. I said, I didn't pay. Anyway, that was it. Then he started paying my school fees. So at a very early age, they taught me the importance of responsibility. And that is a privilege for my parents to be working hard to send me to school and for me to waste the time. And since that day, I always do my best to be among the top in the class. And that helped. And when I was in school then, I used to call myself, I love the doctors. I go to the nurses and I see the doctors in clean dress and all these things. I always say, I want to be a doctor. So in my third year in high school, I started putting doctor behind my name. So I started asking people, how can I be a doctor? And they have to tell me you have to read biology, chemistry, physics, your maths must be good, your English must be good. And so I had that in mind and I dressed myself to it and good enough. By the time I was able to pass my end of high school, my grade was good enough to go to a higher school to get my A levels, and I had a good grade to go and study medicine. The interesting part of it is between the time I finished my high school with and then the time I have to go to College of Medicine, you have 9 months. I have to go and work. So I was teaching in a small school, and the salary then was about 19 naira. Then 19 naira was the equivalent of 19 pounds then. And I know my father, so I have to save a lot of money. So when it's time for me to go to medical school, to Zoom, he asked me, how much have you saved? Then I told him I was saving every month, I was saving 10 pounds, 10 naira. So I had 100 plus with me, including the savings, everything make about 100. He looked at me and said, okay, you can go to med school. He entered his office, opened his safe, and gave me money to my school fees. And I said, your pocket money to start off in school is what you saved. So I wish you all the best. So, and that transfer a huge responsibility to me and also give me an inner joy that I'm contributing to my education. It's not just my father alone. That sort of discipline sort of shaped my commitment and my view about life, that I have a responsibility for myself. And throughout the medical school, that was behind my mind. And he's always saying, let me tell you, there are two things in life. You cannot die of working hard. That what kills people is not poverty and hard work. It makes you work. Is when you misuse opportunity and you think you're enjoying life and doing things that you cannot afford or up to, but morally say, so put that to one, you got to work at. I will give you just enough to survive. Okay? And 3, medical students, one of the downfall is relationship with women, morality. Is that if you, as a medical student, you're exposed to nurses, you're exposed to all these things, you get a hair around you, and if you put any kid in a family way, you're going to marry that kid. Even if that person is a hawker, is nobody, I will make sure. So whenever that thing is ringing bell in my hair, I make sure relationships are very straightforward. Some of my friends are making jest of me when, what medical students, university guidance, they make it jest of me that, I said, well, this is what my father told me, and I know my father will do it. So I'm not in that. I come to study. And that's really helped me through medical school. And after medical school, I had to start my house job. And the funniest thing is that when I got through as a medical school, I went to where you talk to my dad. My dad can joke with you, he can, but he's very firm. But for the first time, he called me a doctor. And he said, have a seat and have a bottle of Mirinda, something like Fanta. And I said, what? It instilled a system that I respect you, but you must earn it in all of us. And that's why the first 5 of us are doctors or professionals and all this. He must say, you must earn it. And that form part of a character. So these are the fundamentals that lay the foundation for my own life. And after that, I was working in the northern part of Nigeria for National Youth Service. About 4 of us were going to start a private practice. So I went to my father to ask him for a loan so that I can join my colleagues to do medical practice. And he looked at me. He said, how many years your experience? You've just finished medical school. Who wants to see you? A baby. Don't you think I was specializing? Don't you think you are doing this? Don't you are doing that? And he said, if you want the truth, I won't pay a penny to see you. You're a baby doctor. So I got that message, but as luck we have it, or nature, the head of state then make a proclamation that nobody can start a private practice without 5 years experience. I look at it as this, as my father been talking to this man, but he has no access to him. Maybe he just thought we young guys are too ambitious and all this thing. And that's when I decided I have to go and specialize. To specialize in what? I look through the government books and I see that there are a lot of gynecologists, a lot of pediatricians, a lot of others, but there are very few eye doctors. So I decided that, and I'm the sort of person that I don't want to just bury my head in medicine. I want to get involved in other things. And ophthalmology then looks a very good place. You don't get emergencies and all these things. And so I decided to apply for ophthalmology in one of the Nigerian universities in Ibadan. The week I resigned to go for that subspecialty, they called me from the ministry. Why do I want to go? I said, well, I've been for the interview. They've taken me. I just want to go. They said, you can't go. I said, why? There's a man who I've forgotten about. When I was done in my house job, I was traveling to Ibadan. I saw a car where there's an accident. Something asked me, go back. You're a doctor. You've seen an accident. You can't just drive past, despite that you are going to a clinic in Ibadan to do some private practice. So I turned around and I saw this man, and they took him out of the car. I followed him to the hospital. When we got to the hospital, the doctor on duty was not there. So I took over, stabilized him. He had a little stroke, he had a cut on the face. So I called my consultant, we stabilized him, and then admit him. After that, I left to go for the weekend to Ibadan. When I came back to the hospital on Monday, I just want to know what happened to the man. It's not in my own consultant, under my consultant. And beside, I saw my best friend's mother sitting beside him. So the wife is my best friend's mother. And so, Dr. Hassan, somebody's been talking about you, Dr. Hassan, and all this stuff. That man, we became friends. Some of his children, through me, did medicine and all this thing, trained them to go and to do all the necessary requirements. We became friends. They just called me and said, no, this man said, and they recommend you to go for in-service training to do ophthalmology abroad. And they will give you a full scholarship. And they made arrangements to contact Professor Folds in Glasgow, and you'll be going to Glasgow. I told him, I didn't apply for it. I'm going to say, no, you did, but you remember what you did at so. Remember this, or this is the sort of doctor we want you. So this is how from nowhere, in 1979, I got a full training scholarship to go to Glasgow in UK to do ophthalmology.
Wow. That's incredible. And honestly, I'm just trying to take that in as I think of that, right? How how God is great, right? To kind of work and make those opportunities. The question now that I would love to have you think about is, what advice can you give to young people today, or talk about today, the state of becoming a doctor today, and talk Nigeria, and then if you want to talk broader for Africa, because we have a broader population also, talk a little bit about what does it take today to become a doctor, and what are the key things that they need to do in order to do that, and if there's areas of resistance, or really tough areas, give some specialized comments. If you could talk about that, that would complement how you did it, but the way they do it may not be the way you did it, right? And so how can they do it today?
Right. Either during my time or time before mine, and now, the fundamental principles is the same. It's only the situation that different. The key thing is yourself. One must overcome self and make up your mind, this is what I want to be. Mm-hmm. And I want to be this, not because I want to make money, I want to do this. You will always have enough to keep going. But are you going it because you want to provide a service? Are you going it in order to take care of people, in order to help, in order to share knowledge, in order to show empathy, and in order to give your best under any difficult circumstances? When your goal is something larger than yourself and you're ready to give, the Lord will always provide a way. So the basic principle is you have got to believe yourself, you have got to have faith in what you're doing, you got to believe that the Lord put you here for something great. And when you get there, you must follow that path that will guide your step. And there's no difficulty that's not one cannot overcome. During our own time, we have challenges too. It might not be as magnified this day where you have all sort of WhatsApp, all sort of social media, all sort of things bombarding everybody. But that time too, we had our own challenges. But it's the fundamental principles that discovering yourself and have faith and walk along a clear pathway that gives you dignity and that also give you the insight into respect others and to serve others. And once you have in your mind, you'll be guided towards the right path. Those principles are fundamental. So all things, we look at temporal things, but all things are spiritual first. And it's that will guide you as you ask, as you tailor your mind and you focus. And there'll be many things you don't see that the Lord, the Spirit will just whisper to you. This small still voice will whisper to you and open your eyes to what you can know. I mean, I always see myself as an example of that. Even throughout my life, even up to now, what I never imagined that I can do, I get it done. So they first of all have to ask questions. Some of them are very brilliant, but there's no focus. Some of them are under enormous pressure groups. They want to belong. I would tell you an example. When I came back to this country, I made up my mind when I'm 40 years, I'm going home. I'm leaving the West, I'm going home. I read my patriarchal blessing, and it stated there that no matter what level I rise in that anywhere, it is in my own country that I will make the impact. And also, my wife was stated clearly, she was a nurse, you have to, with your husband, your impact is in your country. I needed fund to go there. I went to my professor. I was a consultant at 35. and said, oh, there's a top job in Dundee. You can. I said, no, I'm going home when I'm 40, but I need money. He said, Kunle, you need money, fine. And he got me a job in Saudi Arabia, just like that. And I was in Saudi. I was the late King Abdullah, the crown prince then, was my professor's patient. I was there. I was taking care of him. I was in the National Guard Hospital. I have the exposure. I helped them to build the place. And everybody was looking at me that, look, Kunle, don't you know we're here? They say, I'm here not because they like the color of my face. They're paying for my intelligence. And I must also do that job. Not because of that, I must do what I trained the students, and 2 of them were able to get a fellowship within my short time of getting there. I sent them to Glasgow, and they were, planned succession to take from me. And when I said I was going, they increased my mind. I said, no, I'm going home. I know it will be tough at home, but the crown prince said, okay. I came back to Nigeria. I used all my money I made in Saudi Arabia, put them on equipment, and I came back to Nigeria without a car. It's only my wife that bought a car, because the principle is that I'm going somewhere, I must create something new, and I must put all my resources in that. And that's what I did. But all those things are not through my own thinking and all this. It's because I go on my knees, I have a faith I want to go and help people. And I had it in my mind that when I get back to Nigeria, I'm not just going to help the poor, the rich. I must be able to help everybody. My mission is that nobody, irrespective they have money or they don't have money, should be refused treatment in a hospital. Mm-hmm. And that principle today made us to go from 1-room clinic to more than 12 hospitals. Wow. And more than 30 doctors in our practice. And they were all my residents. We started a residency program. So the younger guys of today, you don't see the difficulties. You prepare yourself to pass through it. Those difficult challenges will mold and strengthen your character. People will laugh at you. People will do, but that's not, you know where you're going. And the principles of the church, you can't have. I always bear my testimony to someone. I said, what I learned from the church is more than my fellowship, my 5 fellowships from this, from that. The basic principle, fundamental principle of discipline, business, managing money, and how you go to, you don't see it in any way. You go to university to learn it, but in the church, they give you beyond that. So this younger generation should not take it for granted. They are even more, there's so much available for them to grasp from all the available scriptures, from the church organization. Look at what you are doing. Okay? You are accomplished, but you still feel you need something. You got to pass it on. The joy of it is to pass it on. And that's it. At the end of the day, money cannot buy it. Position cannot buy it. At the end of the day, we're all going to leave it behind. What they will remember us was what we've done, the impact. And that is the important thing the young guys of today have to. They should not be in a hurry. They should not be copycats. They should be thinking that those circumstances that are stated, if you are prepared, there are no fear. They should go by the principles. It will not be easy, but let them look not what they are now, but what they have the potentials to become. And that's what keeps all of us going, to help them.
That's very beautiful. And I love the fact that I can watch this interview over and over and kind of capture these principles again. Let me ask you one question kind of related to young people today and using these time-tested principles that you spoke of. Are there opportunities? What are the opportunities for women today in Nigeria to go into medicine? And how how does a young person do it today? What path should they follow? In the United States, it's pre-med, right? Do they also have like a pre-med path? And can you talk just a little bit about that?
Yeah, the Nigerian system is you go to the high school, and when the high school is divided into two, there's the 5-year junior high school where you have you must come out with distinctions. You must have very good distinction in physics, chemistry, biology, mathematics. And then you go to the higher school where you get A levels, 2 years, and you must have very good A's, at least average of ABB or BBB. You must be around 5 to 6. After that, it's very competitive. And once you get into the med school, that is okay. Then you spend about 5 years in the med school and then do a 1-year internship. And after the internship, you do a 1-year national youth service. Then you can either go into a general practice or you go into subspecialization. Subspecialization, medicine, cardiology, obstetrics and gynae, and the ophthalmology takes about 4 to 5 years. But you are paid during this process. Okay. So anybody that is going to medicine must be prepared for a long shot and must be prepared to really work hard. A lot of it's amazing in Nigeria. Some of the most brilliant doctors are ladies. Nigeria is a place where the women, they matured early. They are more, even is of concern these days, the girls are doing better. They are occupying most of the top posts. Their results in our residency program, most of them are women. At least we have about 15 residents, almost 8 or 9 of them are women. And they're married, they have babies, and they pass their exams. So you see how they juggle the ball and the balance. And we mentor them. The men are a little bit more distracted. I don't know why these days. The men they're just too much distracted. They want to do this, they want to do that. Even as residents, we have to sit down, mentor them, and tell them that, look, at the end of the day, you get what's important first. When you get your qualification, and then you are matured and prepared to go into other parts of life. The women are more malleable, they are more focused, they are more promising in Nigeria than that. I tell you the truth. So and that's one of the things that is affecting the women in the church today. When I was a bishop, I have to cancel a lot of them. When I was in the young men and all this, you see our girls are top-notch. Even if they're not highly educated, they're ready to learn trades. Even the ones that are educated, they're learning to learn skills to support their earnings. And some of them, take it or believe it or not, they're the one that is managing the homes. Yeah. They're the ones that are putting food on the table. Yeah. And that's why some of them sometimes married late. We have to cancel. They're looking for people, boys in the church they can marry, but these boys are not mature. The women mature before them. They are ready to focus, and that makes them even to look outside the church to get married.
Wow. Wow. Okay, Dr. Hassan, we could talk for hours. This is wonderful advice, and yeah, it's beautiful. And I guess one of the things as we close that based on your comments, is that it sounds like you've had this desire to serve, you had a righteous heart, and so the Lord blessed you to have opportunities. But you created those opportunities because of your goodness, stopping to help the person at the accident, and impressing people that you're providing value. You seem like you're always one who's giving and not taking, right? And by that giving, it's created more doors. Does that kind of summarize a little bit of what you said?
Oh yes. Oh yes. There's a blessing in giving. There's a blessing in going out of the way to make things that look impossible to others, to make it possible. and share the experience and mentor them. There's a lot of blessing in that. And the younger generation have to focus on that, which is greater than the monetary reward. Because at the end of the day, you're happy. You can achieve anything. You can dine with the kings. You can die. Once people know you for what you are and what you stand for, it opens door for many things.
Wow.
Beyond your imagination.
Wow.
And this is what they should not lose hope. However bad situation maybe, however it is, there's always a ray of light. But it's only those who are in tune with the Spirit and who have that great insight and believe in himself and know that the Lord put you here for a purpose and he will never leave you. But there's always a price to pay. And that price is follow the commandment, follow the words of the prophet. Embrace all what is in the scriptures, embrace what you learn from other people who are giving exemplary character in the church. There's so much in the church, but apart from knowledge, but people showing ways of life. You know, one man I met in St. Louis that makes a lot of difference when I was there is Menlo Smith. You know, Menlo Smith was the first president of the Temple president. My children were growing up we were fronted, I think. And you looked also, and Oscarson was with. When you look at these guys, and my colleague, Matthew, he was also an ophthalmologist, was the state president. When you look, there's a lot of similar people in Nigeria who can be examples of those guys. But one way or the other, sometimes I think you are too humble for that. You are too this. It's not possible. Your time is this. I told them, no. You guys can achieve greater things. It depends on how you understand, manage your life, and know how to go on your knees and ask for guidance. That's what the church offers. There's nothing you want that the church cannot make you. I'm a product of it. I'm always proud of it. And people always say, oh, you know him. You know, when I was on the board, I was on the board of a big bank. I'm not a banker, but one of my patients called me and said, Kunle, I've known you for years. You're the only friend I have that not asked me for loan or money or for us to do business together. And I told him, why should I come to you to ask you? No, I'm a professional. When I need something, and he asked me to come and be on the board of his bank because he's retiring. And he wants people who can, of integrity. I told him, I'm not a banker. I said, you run an organization. I watch you. I watch your church.
Yeah.
And what you do. I'm sure you can look straight into those boys' eyes and tell them this is wrong. You know, what greater confidence can you get at? What makes you only when we have meetings, they will put champagne there and they say, oh, provide a glass of water, a bottle of water for
well, we better close on that note because I think that really symbolizes that as you live your life well, more and more opportunities will come to glorify God, and because people recognize your goodness. You know, so you really are a light for the world to see. And so, thank you today on behalf of the BYU Management Society for the insights that you've shared, your passion, and most importantly, your spirit. That you have shared with us. We truly appreciate that, and we thank you for your time.
Thank you so much for asking me. I'm available anytime in any of your program, and we look forward to seeing you in Nigeria.